Good afternoon, everyone. Welcome to the Mental Health Coordinating Council's webinar on Embracing Change, a Guide to the NDIS Practice Standards. I'm Carmel Tebbutt. I'm the CEO of the Mental Health Coordinating Council, and I'll be the host for this webinar. Sorry about that slight technical glitch at the start. I would like to begin today's webinar by acknowledging the traditional owners that we're meeting on. Of course, that will be different depending on where you're zooming in from, but for me, it's the Gadigal people of the Eora Nation, and I'd like to pay my respects to elders past, present, and emerging. I'd also like to acknowledge the contribution of people with a lived experience of mental health conditions to mental health reform in Australia. Thanks for joining us today. We had over 600 people register for this webinar, which I think just demonstrates how much interest there is in this topic. MHCC have been funded by the NDIS Quality and Safeguards Commission to develop resources to support providers of psychosocial disability services better understand the requirements of the NDIS practice standards, and we thank the Commission for their support of this project. This project has been undertaken in 2 phases. So the first phase of the project included 10 webinars, which covered various aspects of the practice standards. And I'm sure that many of you on this webinar today may also have participated in those webinars. But today, of course, we're launching the resources from the second phase of the project. And this includes a guide to the NDIS practice standards and also an interactive self-assessment tool. So we're due to finish this webinar at 4 p.m. The webinar is being recorded, so if you're unable to stay for the whole event, you'll be able to access the recording from our website. I'd now like to share with you the 2 presenters who we'll be hearing from today. We'll be hearing from Katy Sam and James Houston, and we'll then have a question and answer session. So if you've got any comments or questions, please put them in the Q&A box and start doing that as the presentation starts, and then we will get to as many of the questions as we can at the end. So I'd now like to introduce our first presenter, which is Katy Sam, who is the project coordinator for Embracing Change. And Katy's background is in social work, and she's worked in both clinical and project roles within government and also the community managed sector. Katy's committed to supporting capacity building initiatives for the community services sector to promote better outcomes for service users. I'd very much like to welcome Katy and look forward to hearing her comments about this amazing project that she's overseen. Thanks, Katy.
Thank you so much, Carmel. I'm just going to share my screen as I've got a couple of slides. Okay. So, as mentioned, my name is Katy and I'm the project coordinator for Embracing Change. And today I'll just be providing a little bit of background to the Embracing Change project and what we have endeavoured to achieve. So as Carmel briefly mentioned, the Embracing Change project set out to support the transition of NDIS registered psychosocial support services towards meeting their legislative requirements. The project has been delivered in 2 phases with the support of the NDIS Quality and Safeguards Commission, who funded the project. So phase 1 of the project focused on the needs of psychosocial support services transitioning to the NDIS. And the skills and competencies particularly identified that education, engagement, and communication methods should be informed by lived experience of psychosocial disability and recovery, as well as tailored to meet the needs of the individual when delivering psychosocial support services. So as Carmel mentioned, phase 1 delivered 10 live webinars based on the key principles and functions of the NDIS practice standards, with these tailored to the needs of psychosocial disability services and NDIS participants living with psychosocial disability. as well as establishing an NDIS and psychosocial disability quality and safety forum. And you can find recordings of these on the MHCC website if you're interested and haven't had the opportunity to view them for yourself. So phase 2 of the project has developed and delivered online resources which aim to further support capacity building for NDIS registered psychosocial disability services. So these resources aim to improve an organisation's overall quality management approach to delivering services and meeting the requirements set out in the practice standards by the NDIS Commission. So this was an incredibly important task, as we know that the promotion of and delivery of high quality services is an important safeguard against the risk of significant harm for people living with disabilities. So I had the honour of conceptualising and developing the phase 2 resources with Breaking New Ground and co-authored the published resources with the Western Australian Association for Mental Health, who are the peak body for CMOs in Western Australia. So the resources developed were an online self-assessment tool for the NDIS Practice Standards and a downloadable PDF guidebook to better understand the NDIS Practice Standards. And it's our hope that these resources will enable NDIS providers of psychosocial support services to achieve greater consistency in service delivery practice and encourage capacity building that aligns with the practice standards. Because providing NDIS participants with quality support and services in a safe and competent environment with care and skill is an important obligation for all NDIS providers and is fundamental to the rights of people living with disability. So who are the resources for? So the target audience for this project includes both existing and prospective providers of NDIS psychosocial support services, small to mid-size, who have varying knowledge and competency levels in meeting the NDIS practice standard requirements. So whilst registered providers only can access both resources, prospective providers can access the guidebook, which provides material that will assist them in their deliberations as to whether or not to proceed with registration or not, and whether they have the capacity to fulfil the requirements by the NDIS Commission. So, oops, sorry. The guidebook was developed to support services and promote self-confidence in understanding the NDIS practice standards by further explaining what each quality indicator of the standard intends, as well as providing further reading material and resources to enhance understanding of each quality indicator. So the guidebook covers the 4 core modules as set by the NDIS Commission, as well as the 2 supplementary behaviour support modules, as we felt that these would be relevant to our psychosocial disability support providers. And the further reading material and resources related to each quality indicator within the modules include links to various different mediums, such as examples of policies and procedures and helpful templates, informative sector podcasts and videos, relevant Commonwealth and state legislation and policies, the relevant Embracing Change Phase 1 webinars and resources, helpful information websites and apps, relevant existing MHCC resources such as the Reimagine Today site and the Mental Health Rights Manual, mental health and disability sector frameworks, toolkits and discussion papers, available online training opportunities, relevant current NDIS Commission resources and supporting information, as well as much more as well. And in terms of the aims of the guidebook, there was a dedicated effort in the development to reflect evidence-based practices which are known to encourage greater outcomes for people living with psychosocial disability, including the promotion of trauma-informed and recovery-oriented practice, supported decision-making, and person-centred and led practice. And while most people consider the practice standards set by the NDIS Commission as primarily focusing on the formal quality safeguards requirements of services, there was a concerted effort in the development of the guidebook to also highlight the informal or natural safeguards which protect and uphold the rights of individuals. So natural safeguards are the protections that accompany personal capacity building, such as through supported decision-making and peer advocacy support, to help people living with disability to exercise more choice and control, empower and protect themselves. And natural safeguards are also the protections that accompany the fostering of interpersonal connections, including connection to culture and the visibility that comes with activity and participation in the wider community. So it was therefore important to highlight the NDIS Commission's inclusion of these natural safeguards within the practice standards and a provider's obligations to meet these. The guidebook additionally emphasises the importance of involving participants and staff in service design and evaluation to promote continuous quality improvement, which aligns with the needs of people directly impacted by service design. As we are aware, the safeguarding space is new and ever evolving, and we've done what we can to help clarify the roles and responsibilities within an organisation in complying with the practice standards and how this sits across the various levels within services. The Royal Commission has highlighted that service provider management committees or boards are at times unaware of their accountability or governance requirements with respect to risk management, quality monitoring, incident and human resource management. So our guidebook has attempted to help illuminate their requirements alongside the day-to-day practice of service delivery staff and management. Also, the guidebook has been developed to work alongside the online self-assessment tool as it provides a greater understanding and explanation of the quality indicators of the practice standards to assist in preparation for assessing organisational compliance with the NDIS Commission's requirements. So MHCC collaborated with Breaking New Ground in the development of the online self-assessment tool to assist registered NDIS providers in assessing their compliance to the standards and promote further capacity building efforts within organisation. And James Houston, the director from B&G, will be providing a comprehensive demonstration of how the tool works and how it can assist quality improvement measures within your organisation. But in short, the tool helps organisations to practically identify their strengths and areas of improvement in meeting the NDIS Commission's quality and safeguarding requirements. So we hold great hope that these resources will help support a positive culture within organisations around safety and quality of service delivery, and how this can help support greater outcomes for people living with psychosocial disability. So I will now have the pleasure of passing on the presentation to James Houston, the Director for Breaking New Ground NGO Services Online. B&G is a leading provider of online solutions for Australian community services and health service providers in the areas of quality and service standards, quality management systems, and organisational capacity building. Thank you, James.
Thanks very much, Katy, and thanks, Carmel, for your introductory comments. Now, my name is James Houston from B&G, and what I might do is just start to share my screen to start off with. Okay, hopefully everyone can see that. Is that okay, Katy? Hopefully you can see I'm on your website to start off with.
Yep, we're there.
Excellent. So, as Katy and Carmel have explained, we're working with MHCC, or we've worked with MHCC to develop the NDIS Practice Standards Self-Assessment Tool. I think there's probably a number of people on the call who'll be familiar with our broader online compliance platform, SVP, which hosts the self-assessment tool. I've certainly seen a couple of people in the chat already making comments, names that I'm familiar with. Now, to start off with, the reason why we're just looking at MHCC's website here is I just want to make it clear in terms of how everyone can look to set up an account in the new self-assessment tool. So I'm here under the publications and initiatives section, or the embracing change section on MHCC's website. And if you scroll down, you can see this is where the guidebook is. And then underneath that is we have the self-assessment tool. If you click on this link here, it will take you to a registration page where you can set up an account in the self-assessment tool. So all you need to do when you come to this page is type in your email address and your organisation name, and then click on the subscribe now button. Don't be spooked by that. You know, as the text here explains clearly in capital letters, the portal is free. So there is no cost to set up an account in the portal. We had someone set up an account this morning and they got halfway through the process thinking, oh, I'm a bit scared about clicking on that subscribe now button because I might be hit with some costs. But no, it is a free self-assessment tool provided by MHCC. So once you've actually set up your account in the self-assessment tool, let's jump in and have a quick look at the platform. So we're here on the home page, and when you land on the home page, you'll see a little bit of introductory text to the tool explaining how it's designed to support the sector and assist with capacity building. And then on the home page here, we have a link through to the guidebook, which of course, you know, it's also accessible on MHCC's website. And then if we scroll a little bit further down on the home page, we've got two things explaining how the portal works. We've got a PDF user guide, which is just about 10 or so pages explaining some basic things about how to log in, how to self-assess, how to link evidence, etc. And perhaps even more simply, we've got a 9-minute video explaining how to use the self-assessment tool. And then down the bottom of the page here, you'll see that we have the 3 assessments for the core module, the specialist behaviour support module, and the implementing behaviour support plans module. So if we just start off by clicking into the NDIS Practice Standards core module, and again here with the introductory text to this assessment, we again have a link to the guidebook. And then what we can do is expand any of the 4 standards heading: rights and responsibilities, governance, provision of supports, and support provision environment. So if we expand the first heading, rights and responsibilities, then we can look to click into the first module in relation to person-centred supports. So once we've clicked into the assessment module around person-centred supports, we see the definition of that outcome, which I don't need to read out because I'm assuming everyone on this call will be familiar with the NDIS practice standards. And then down here, you'll see what's really helpful is within every single module, and remember each practice standard has its own module, MHCC provides an evidence guide in relation to the underlying indicators of, in this case, it's an evidence guide for person-centred supports under Standard 1, rights and responsibilities. And then you'll see just here, maybe the font's a bit small, I might slightly expand the font so people can see that. Looking at the very first indicator, each participant's legal and human rights are understood and incorporated into everyday practice. MHCC has provided some suggestions around documented evidence, as well as examples in everyday practice or service delivery. We scroll further down the evidence guide, we look at the second indicator under person-centred supports, and likewise, there's suggested documented evidence and examples in everyday practice. So that's how the MHCC evidence guides work for each practice standard. And then what you can do is come down and online work through your self-assessment in relation to each of the indicators. So you can tick off the first indicator if you feel that you're doing a pretty good job in relation to each participant's legal and human rights being understood and incorporated into everyday practice. If, however, you perhaps think you're not doing such a good job and you feel you might need to do a bit more work in relation to this particular indicator, then what you can do is assign an action to one of your colleagues, or even to yourself for that matter. So we might decide, I might assign this action to myself. James, please review our NDIS participants' rights policy, and I can put a due date on that and then start to work through the other requirements. Just for illustrative purposes, we might sort of save our answers. We'll just answer met to the other two requirements. And then when we get to the bottom of the quiz, we can type in any supporting comments in relation to how we might be meeting this particular practice standard. And you can see there's a 3,000 character word limit, which probably equates to approximately sort of 400, 450 words, something like that. So I've just put in some sample text in relation to person-centered supports. Of course, at any time, you can log back into the platform and you can update your comments or add to your comments. Now, the other thing that we can do in terms of addressing person-centered supports is we can then look to link evidence against this particular practice standard. So if we click on the link evidence button, this is a demo account where we have already pre-populated some evidence docs here, but I'll show you how to load up some new evidence docs as well. So maybe we can just look for some different evidence docs that we might load in here. We might load in our code of conduct. So let's just link those a few evidence docs in there. So you can see we've linked in 2 evidence docs here that in this demo account we'd already preloaded into the platform. If we wanted to load up a new document into the platform, we click on this Add New Evidence button. We can go into you can go into your computer folders and load up an evidence document, or even what you can do is you can load up a hyperlink. So for example, I was looking on MHCC's website before today's session, and I noticed that MHCC has its privacy policy on its website. So we could put that in. And the point that I want to make is that if you are linking any evidence to demonstrate how you might be providing person-centered supports, you can link in as much as you want, and it can be any form of evidence, whether that's a Word doc, PDF, Excel, or a hyperlink that goes somewhere else. And even to that end, it doesn't necessarily have to be to your website. For example, we use SharePoint. So as an example, I could put in a hyperlink that goes to a policy document that sits in SharePoint, for example, which is obviously a secure cloud-hosted documentation management system, but we can put in a link that goes to a single policy document or even a bundle of policy documents in SharePoint. So that hopefully just gives you a bit of a sense as to how you can link evidence in relation to each of the underlying practice standards. I want to come back in a moment to how we have answered not met to one of the indicators and we've assigned a task to a colleague, because an important part of this process, as Katy was alluding to earlier on, is working out what you're doing well, but also identifying any gaps that you might have in place as well. So what's going on in the background of the platform is it also registers any of those not met items, any of those indicators where you said you're not you're not meeting them, and in doing so, you've identified an actionable item. So that actionable item will be in the NDIS Practice Standards Action Plan. The other thing that we can also do is we might choose to add a custom action in relation to person-centered supports. So over and above how we actually answer each of the questions that relate directly to the indicators, we might decide that we've got a CQI action in relation to person-centered supports, whereby we might say that we need to undertake some diversity training for all of our staff. And again, we could assign that to the same colleague or a different colleague. And again, we can put a due date on that particular item. So what I want to show you in a moment is how that standards action plan captures all of those actionable items that we have identified on the back of our self-assessment against the NDIS practice standards. So once we think we're happy with the work that we've done in relation to person-centered supports, in the top right-hand corner, you'll see there's in blue a next assessment button. We can simply click on that next assessment button, and then it takes us through to the next practice standard in relation to individual values and beliefs. And then we simply start to work through the same process again in terms of addressing the indicators, referring to MHCC's terrific evidence guide for that particular practice standard and the underlying indicators. So very simply, that is how we work through each of the practice standards and against the NDIS practice standards overall. So let's just pause for a moment. We can come back to this page here for the NDIS practice standards, and you can see we've started to make a bit of progress against person-centered supports, but we haven't ticked off all of those indicators as yet. What we can also do is a couple of things. On the back of all that work that we've completed, we can go to the evidence pack. You'll see the blue button in the top right-hand corner. For the core module, we can click into the evidence pack, and here you'll see before today's session, I added in a couple of additional documents in here, but you can start to see that we're populating our assessment against the NDIS practice standards in the self-assessment tool. And this evidence pack is a nice summary collation of all of the evidence that we might have linked throughout the NDIS practice standards. If we change our mind, if we decide that, for example, the MHCC privacy policy on its website is not so relevant to person-centered supports, we can unlink that item in terms of evidence from the self-assessment. Or here in the summary evidence pack, we can decide to link some more evidence if we so choose. We can also add in comments at more of an overall level, as opposed to the comments that we've provided inside each of the underlying practice standards. And we can generate a couple of summary reports of our self-assessment work against the practice standards. So the first green button, the assessment report, is very simply just a PDF version of what we're looking at on screen here. So if we have a look at that, person-centered supports, individual values and beliefs, you'll see here in the right-hand column is all of the linked evidence documents. The other report is what we call the Q&A report, which is then a summary of all of our answers to each of the questions that relate directly to the indicators, including our qualitative comments explaining how we meet each of the underlying practice standards. And then you'll see in the right-hand column, there is the list of linked evidence documents against the standards. This report can then be downloaded into PDF, and it can also be downloaded into Excel. So that's a quick look at some of the summary outputs in terms of all the work against the standards. The other point that I want to come back to briefly is the action plan. So with the action plan here, we can look up the action plan for the NDIS Practice Standards core module, and you will see this is that first question around each participant's legal and human rights. This is where we suggested that James should review our NDIS participants' rights policy. Now, when we assign a task to a colleague, they will receive an automatic email notification. And you can see with these other items underneath, there's that, that custom action, that continuous quality improvement item in relation to person-centered supports. And then we've just populated another item that's further down in relation to emergency and disaster management. But if James received his email notification, he could log in and he could filter under his own name and find the item that has been assigned to him. If he completed that item, it would disappear from the on-screen action plan. So after that had been completed, we could look at the outstanding actionable items that have not yet been completed, but also what can be done is the action plan can be downloaded into Excel and it can be taken offline into a team meeting. So when we do that, when we download the action plan into Excel, you'll see it captures all three items, including this first one, which is now tagged as having been completed, and it's date stamped as having been completed on the 18th of August today. So this is just a nice record, not just of the outstanding actions that have been identified, it also captures the actions that have been addressed as well. The other tab at the top of the page you'll see is the Documents tab, and this is just a repository of any evidence documents that you load into the platform. And a couple of things to point out here. We can search for any evidence documents. We can type in PRIV and look for anything with that combination of letters in it, or you could type in something longer than that if you wanted, you know, or code, sorry, if you wanted to look for your code of conduct or whatever it might be. You can download a report of all the evidence that you might have loaded into the platform. So we can have a quick look at an Excel report of any evidence documents that we might have loaded into the platform. And you may load up quite a few evidence documents over time. And then you can see here the simple report. It's got 4 columns: the document name, the underlying file name when it was loaded up into the platform, including URLs if it happens to be a hyperlink, the date it was loaded up, and any assessment modules or underlying practice standards that it might have been linked to. So that can just provide a nice, concise summary of all the evidence that you might have in your account. The other thing that you can do is you can relatively easily bulk upload evidence documents into the library rather than loading up a single document at a time. You can upload multiple docs. You might decide that you've got a safeguarding committee in relation to the provision of your NDIS services, and you felt that it might be relevant to load up all of your committee minutes. So you can simply drag and drop them, you know, bulk upload them into the platform. And then once they're in the platform, as you're self-assessing against the NDIS practice standards, that they will immediately pop up and can be easily linked against any of those underlying practice standards. So it can just be quicker to preload evidence documents into the platform rather than loading up one at a time when you're self-assessing. So where are we at? 3:35. I'm now 20 minutes in, so I just want to keep track of how quickly or slowly I'm running through today's presentation. Now, some other things that I might point out. When you set up an account in the self-assessment tool, it's also worth pointing out that you can invite in any other colleagues into the platform. So you can simply do that, assuming you're an administrator of the account, is click in that top left-hand corner, come to this page, and this is where you've got an add other users button, which will list any of the users in your account. And then you can choose to add in any other colleagues into the platform as an administrator, a user, or a reviewer. If you invite in someone as a reviewer, it gives them a read-only access to the platform. So for example, if you're going through an audit, you could invite in your third-party auditor as a reviewer, and that way they could review all of the work and linked evidence that you've completed as part of your self-assessment against the NDIS practice standards, but they couldn't actually change your answers or delete your evidence or add in any additional evidence. So it's simply a case of typing in the email address, assigning them as a reviewer, and clicking the add button. So that's a quick run through how the platform works. I'm probably running a little bit ahead of schedule, Katy, so I might just pause for a moment and see if we've got any questions that have come up.
Yeah, sure. So please feel free to keep sending in some questions. It's great that people are engaging. What I might start with, James, is who in an organisation should be completing these self-assessments?
It's an excellent question, Katy. I think it's probably going to differ organisation by organisation. You know, what we find with the wide range of NDIS providers that we talk to in terms of who is undertaking that work against the NDIS practice standards. Obviously, in larger organisations, they tend to have a dedicated quality and compliance team or individual who looks after a lot of that work. The smaller you go, which might include a lot of providers on this call, it tends to be, you know, potentially, you know, one of the senior executives or even the CEO getting closely involved in a lot of that work. But I guess, you know, the NDIS practice standards are designed for the organisation overall. So it makes sense that, you know, you have a range of people involved in demonstrating how you are meeting the breadth of those requirements across the entire standards. So it's probably not really a case of, you know, a single person for any organisation. It's a team effort. And also in relation to identifying those gaps and areas, potential areas for improvement, obviously, again, that's sort of organisation wide in terms of how you address those particular items as well.
Thank you. And how often do organisations need to be going through this assessment process? Is it every year? Is it every time they're going through an accreditation process? What, in your kind of expertise, do you recommend?
Again, excellent question. I would say that it's an ongoing process. You know, everyone always talks about continuous quality improvement, and I would imagine that what the Commission would like to see is that the organisations are looking, or providers are looking at the NDIS practice standards on an active basis. And, you know, when they get feedback and complaints, when incidents happen, you know, as things evolve, you know, they're learning and making changes as they go. The idea of the self-assessment tool is it isn't like SurveyMonkey. You just go through and say, yes, 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 you know, this is what I'm doing. It's designed to be used on an ongoing basis. So at any time, you can go back in and amend your answers, you know, your qualitative responses to any of the practice standards. You can add new evidence docs, remove evidence docs, replace evidence docs. You can do a simple edit replace. You might have an overarching governance policy that relates to several different component parts of standard 2 around governance and you know, operational management. If you update that governance document, you could do a simple edit replace, and immediately that will be updated wherever the original document had been linked to, for example. So yeah, I'd say it should be thought about as being used on an ongoing basis. But the reality is, I think from our experience, a lot of providers are rushing to get ready, for their audit that might be coming up on a designated date. And once they make it through that, they might sort of take a bit of a breather after that. But certainly, it should be used as an ongoing tool.
And can these evidence and can this be used to show auditors as part of those accreditation processes?
Can you say that again, Katie? I think you just cut out a little tiny bit.
Oh, sorry. So can the tool be used as to be able to show to the auditors in those accreditation processes, do you think?
Yeah, sure. So absolutely. So the self-assessment tool will capture all of a provider's work against the NDIS practice standards. It'll provide those, summary outputs which can be downloaded and taken offline, but equally an auditor can be invited directly into the platform, and we've done that. That's happened in many instances, and even it's possible to link a provider's account directly to a wide range of reviewing areas that we've set up for a lot of the NDIS approved auditors already in our broader SPP platform. So obviously it's important to point out that any organisation's account is only available to that organisation and to staff members that they invite into their account. So it's completely secure. However, for example, if a particular organisation wanted to, it can directly invite in a third-party auditor into their account, or equally, with their permission, they could ask us to link their account to one of the reviewing platforms that we've set up for, that many of the NDIS approved auditors. But short of that, no one else sees your work in the platform. There's no data, or aggregated data that's taken out of the platform at all. No one else has, no one has any visibility on the work that a provider might be undertaking in the platform.
Okay. And when you're inviting an auditor in, my understanding is that they can have just a read only, so they're not able to make any edits or anything. Is that right?
Well, that is correct, except they can actually, within the platform, they could add in a custom action. That's the one thing an auditor could do in case they wanted to provide any suggestions within the portal. Except, I'd suggest that probably, each auditing body is going to have their own way in which they're going to interact with the providers that they're auditing, and their own way of providing advice around how that particular organisation might be meeting the practice standards, or any area for non-conformance, etc. So,
and we've got a question here from Mary, and it's saying, how are you verifying the person filling in the action questions is the same person delivering the service? And I'm feeling like, because you're saying it might be higher up management, but have you had any experience of understanding how the actions are then getting communicated to the people that are delivering the services?
Look, each organisation will be using the portal in their own ways. So we don't monitor how the portal is used, or monitor who's completing the assessment questions, or who's being assigned actions, or are those actions being addressed once they've been assigned to various staff members. It's really up to the organisation around the internal protocols they might set up around who's undertaking the self-assessment work, etc. Yeah,
and look, a lot of the questions that are coming through is about the kind of security of the documents and the evidence that you're uploading, and it sounds like they are nice and secure, which is...
Yep, absolutely, all completely secure. As I said, the NDIS Practice Standards self-assessment tool that we're looking at here is hosted on our broader standards compliance platform, SPP, which has been around for a long time, well, over 10 years. And we've had, a very large number of organisations going through NDIS audits and audits across a wide range of other health and human services standards all around the country. So absolutely, all those information safety systems are all in place, etc. And we can provide a bit more information if any particular organisation needs to see them.
Yeah. And so do you think that more than one person in an organisation should be completing the self-assessment to get a more balanced outcome?
Again, it's like what I was saying before. I think there's no single response to that. If you're talking about a really small psychosocial provider with a very small number of staff, that's going to be very different to a larger provider. So yeah, I would say absolutely it makes sense for more than just a single person to be working through the NDIS practice standards, but obviously for a very small provider that just may not be realistic or practical.
Yeah. And there's which question there? So if an NDIS organisation is providing multiple different services, are there different assessments that they can do to be able to assess themselves, or is that then up to different people in the organisation completing what's relevant to them?
It is actually possible to configure it whereby you could have multiple services within the one account, but they probably need to reach out to us to talk about that in terms of how that might be configured. So on that registration page that we were looking at right at the start, our contact details are here in case anyone's having trouble setting up their account, or if they've got any other queries like that where they need something, a little bit more complex than just that single account, for a single organisation. But yeah, absolutely, that sort of thing is possible. Yeah.
Okay. And what kind of preparations are people needing to do before they undertake the self-assessment? Are they needing to read the 90-page guidebook, do you think, or what do you recommend?
That's an excellent question, Katy. I would say if you look at what we did when we went through that brief presentation as to how you self-assess against person-centred supports, I would say that it's handy to have the overall guidebook available, but when you click into the module in relation to person-centred supports or individual values and beliefs, there's the little MHCC evidence guide. So, I think it's a case of, re-familiarising yourself with each of the underlying indicators and then saying, well, what has MHCC suggested in terms of examples of documented evidence or examples of, everyday practice around what we need to be thinking about in relation to this practice standard. Of course, I'm sure MHCC, and we would love everyone to read the full guidebook in one go, but from my experience, 90-page guidebooks can be spooky for a lot of people. So I think that, breaking the NDIS practice standards down into its component parts, and they're obviously very detailed and more detailed these days since the introduction of the new requirements in November last year. It's a case of probably working through it bit by bit. And I think doing it that way as well, if you read the full 90-page document and then you get to person-centred supports, you think, I need to go back to the guidebook because I've actually forgotten page 10 to 15, which is on person-centred supports. So yeah, I'd say that's the best way to go, bit by bit. And that's how the portal works, because again, realistically, as the NDIS practice standards, they are, hello?
Oh, you're just a bit froze. There we go, you're back.
I don't know what happened there. It's almost like we had a power outage. Can you still see everything at your end? Wow, that was
all good.
strange. It's like we had a blackout or something going on here. That's completely thrown me out now, Katy.
So it's you can kind of go in and out of the tool. I think you were.
Yeah, exactly. That was the point I wanted to make. So rather than reading the guidebook in its entirety, because the NDIS practice standards there's a lot of work there that a provider's got to do to work through the NDIS practice standards. It makes sense to do it bit by bit, and to work through different practice standards. But you were asking the question earlier on around, well, should just a single person be doing the self-assessment, or should there be multiple people? If you think about the structure of the NDIS practice standards, and then the structure of a typical sort of organisation, whether it's small, medium, or larger, is, well, you might have a certain staff member who's in the HR team who's looking after the HR management requirements. You might have someone else who's looking after some of the broader governance-related requirements, and then you might have more of the frontline staff members who might be looking after some of the other aspects of the practice standards. So you can divide up the work between different staff members according to who's best placed to address those different requirements.
Yeah, like I could envision something interesting as using the tool in like a group supervision kind of format with your frontline staff, and kind of going through it and using it as a reflective tool, not just as kind of a auditing tool. It's a way
Absolutely.
of reflecting on what you're doing and how you are meeting both the formal and informal safeguards.
Yeah, absolutely. And I think that's a great answer to the earlier question as to who should get involved. Yeah.
And a question that I was expecting, and we've had it a couple of times, is around why we've only included registered providers for the self-assessment tool. And I guess it's really that answer is down to limited funding, and we're very lucky to have BNG on board. And as James said, they're available to be able to support the registered providers who are part of the tool, to be able to help them along the way if they need. And it just came down to the amount of funding that we have available to kind of have the tool running. But we hope that for the non-registered providers, that they can utilize the guidebook as their own kind of ticker box. And because it's very similar, because the self-assessment tool really is just asking questions around the quality indicator. So again, if you're a non-registered provider, you could open that up with your frontline team and kind of read through the kind of core module 1 around your person-centered practice and those kind of things, and tick it that way and create your own kind of Excel spreadsheet. But yeah, we would have loved for it to be freely available to everyone, but we just had to limit it due to the funds, and also because of the work that BNG are doing behind the scenes for the registered providers. Any other questions? So is this designed only for psychosocial delivery support providers? So we've somewhat tailored it, but I think it can easily be translated because the core modules are set for all registered providers. So I think that all NDIS providers registered providers and have a go and make it work for them and link their relevant evidence, because it's not a set or assessed tool kind of on BNG side. It's for your own organisational assessment. Sorry, just going through. And James, is there anything else that you think is the biggest kind of take home for, now we've got kind of 5 minutes left, any big take home questions that or comments that you think for people to kind of motivate around engaging with a tool like this, or the main benefits that you've seen from other organisations that use similar tools?
Look, I think we've covered off a lot of the key points today, Katy. I guess, on the back of the new requirements that came out late last year, where I think still a lot of providers are looking to get into place, how they're actually addressing all those new requirements. Obviously, the self-assessment tool is fully up to date and captures all of those new requirements, and they are, they're pretty detailed. There's a lot of work there to be done, even for providers who have already been in the NDIS practice standards prior to those changes that came out late last year. So, yeah, I'd say, in particular, it's worthwhile looking at some of those new areas, and obviously emergency and disaster management is one of those key areas where there's a lot of auditor focus right now. So having to think about, how you might be addressing those particular requirements, particularly, not just at an organisational level, but at a participant level as well. Ensuring that, you've got systems and processes in place to provide ongoing supports, even in the event of some sort of emergency or disaster happening. So I think that's an important area of the standards, but that's probably talking more about the standards than about the actual self-assessment tool itself.
No, but it's a good focus. Like, that's why we're here and why we've been funded is trying to, I guess, encourage engagement, and so that, I guess, the people living with disability and their carers are also seeing the results of services engaging in quality improvement and are motivated by it, which I think is a important thing, and which is, I think, a hope of this self-assessment tool in particular. I think it is so easy to use. I'm no tech savvy person, as anybody in my office can attribute, and I found it really easy to use, and just a nice, not daunting way of wrapping your head around where we are and where we need to go, because I think there's always room to grow in an organisation, and it seems that this is a really nice way of capturing that, and then being able to easily communicate that to the organisation as a whole as well, through those action plans and things like that you can download in a PDF. How easy is that then to be able to just send around to your organisation? So yeah, I think it's a great tool, and we're very thankful to BNG for hosting the platform, and we're really excited to hopefully see the outcomes of it as well. So I think that might wrap up our Q&A portion there. I'll invite Carmel back on.
Thanks, Katy. Thanks, James. That was an excellent presentation. And I think from the range of questions and comments in the chat and Q&A box, there was huge interest. And I think you well covered what these really excellent resources can do. Of course, at the end of the day, they are tools and resources. They're aimed to capture what an organisation is doing and make it easier for an organisation to organise their material. It doesn't replace the requirement or the need for an organisation to do the things they need to be doing to meet the practice standards, but very valuable, I think, for organisations to prepare themselves for the audit process. So I do want to, in just the last couple of minutes that we've got, congratulate Katy for her management of the project. She took this project on midway, and she used her exceptional skills and expertise to guide the project to a very great finish. So Katy, well done. I think it's a tool that is going to have enormous value and applicability across the sector, and you've done a great job. So thanks and congratulations. I want to also acknowledge Corinne Henderson, our Principal Policy Advisor, who supported Katy with this work and has been very involved in this project as well. I want to thank James, because you've been incredibly patient and flexible, and BNG have had to work within the constraints of the grant that we received and the requirements of that grant, but they've done that very well, and I think it's extraordinary that we can make this tool available to organisations free of charge. So thank you very much, James, for B&G's flexibility, your flexibility. And I do want to acknowledge WAM. I know Katy already did, but WAM is our sister peak in WA, and the work that they did on their guidebook was so valuable in getting us started, and we've used some of that in our work. So thank you to WAM, and thank you to everyone for participating. We had a huge showing in this webinar. I think, again, it just shows the interest, as I said at the beginning. If we didn't get to your question, we will try and respond to those after the event. And as I said, the webinar will be on the MHCC website in a few days. We will be sending out a short evaluation survey. Please complete this survey. We need this information to be able to demonstrate to funders that we're doing a good job and to get more grants to do more work like this. So please complete the evaluation survey, and I hope to see you at another MHCC event soon. Have a great afternoon. Goodbye.